time in our busy lives for self-care should be a priority, especially when it comes to our health as we age. Dr. Yvonne Queralt from ARA is here to share important information about a disease that mainly affects women over the age of 55. Dr. Queralt, thanks for being with us.
Thank you.
So this morning we're learning a bit about uterine cancer. How do you describe that?
Uterine cancer is a broad term that it basically means any cancer that can happen within the uterus. The uterus can be likened to a muscular sac with an inner lining. And while cancer can involve any portion of the uterus, it most typically involves that inner lining called the endometrium. Endometrial cancers account for 90% of uterine cancers.
Interesting.
The endometrium is a dynamic structure, meaning that it changes throughout the menstrual cycle in response to hormonal changes. Normal endometrial cells proliferate and then shed during menses in response to changes in hormone levels in the blood.
Yeah.
Cancer cells are abnormal. They proliferate and shed out of control, forming a tumor.
Wow. Okay, so you're a radiologist, so you work with imaging. Can you describe the role of imaging in helping to diagnose uterine cancer?
Sure. So a patient typically will present to her doctor with a symptom. Most often it's abnormal uterine bleeding.
Okay.
And the doctor will take a history and physical, and typically the first test that will be ordered is a pelvic ultrasound. And that allows us to look at the uterus and the endometrium. We look at how thick the endometrium is, what it looks like, compared to what it should look like for the patient's age.
Right.
Depending on the results of this study, together with clinical suspicion, a biopsy of the endometrium may be performed by the gynecologist. If the results indicate that tumor is present, the patient is referred to a gynecologic oncologist who will want to know the staging or how much of the uterus and surrounding structures is involved by tumor.
Right.
And for this, MRI of the pelvis is gaining an increasing role in pre-surgical staging of disease.
So you're going to show us some examples of uterine cancer. So what are we looking at here?
So this is just a basic cartoon of the female pelvic anatomy, and this is cut right down the middle as if she is looking at me and her back's to you.
Okay.
You can see that the uterus is an organ right in the middle of the pelvis with the bladder in front and the colon in back.
Yes, okay.
Next slide.
So next slide. Okay.
So similarly, this is what we see on MRI. So the endometrium, which what we're talking about, is this nice white stripe down the middle, and the rest of it is muscle.
And this is a healthy image?
This is a healthy, normal uterus. So taking the normal on this side, we have abnormal on this side. These images are obtained using the same technique, and you can see the abnormality. The endometrium is thickened, and instead of nice white, it's gray.
Oh, it's gray, and the shape has changed as well.
The shape has changed. The cavity is enlarged. This is a similar picture, and we've introduced contrast, intravenous contrast, and so the muscle enhances to a greater extent than the tumor does.
Okay. So more to see here? Okay.
So on this one, again, I've taken a normal and an abnormal. This is after contrast. On this, you can see that the gray tumor has invaded the muscle and nearly goes to the outside.
Wow.
So this is a higher stage tumor. It's a 1B tumor.
Okay, and what else do we have?
So the tumor, this is a stage 2, a higher stage tumor in which the cancer has not only expanded the endometrium, it's also gone into the lower part of the uterus called the cervix.
More? Okay.
And this last picture,
Let's see. There we go.
This last picture is the cancer has not only gone through the cervix, but it's also gone into the vagina. To make it a little simpler, it's this area here. So you have tumor that's involved the endometrium, gone through the cervix into the vagina, and that's a higher stage cancer.
So there's many stages. So that's, you guys help in the role of diagnosing and finding where someone is.
Right. The doctor's going to want to know what the extent of disease to find the optimal treatment strategy for that patient.
Right. Thanks so much. That was so informative and really good to know about. Where can people go for more information about ARA?
We have clinics all over town, and with all our imaging modalities at almost every one.
Perfect. And if you want to make an appointment, there's the number on the screen, or you can head to ausrad.com. Doctor, thank you so much.
Absolutely.
Stick around. Coming up next, this one-of-a-kind truck doesn't mess with Texas. We're learning how this customized ride is benefiting Hurricane Harvey relief. Stick around.